Okay, so we should just wait a few more minutes. Is that right, Ella? Okay, so in the meantime though, welcome everyone, and I'm going to do something slightly different today. So I'm going to pick someone at random, and maybe you could just introduce yourself and just say where you're from, who you are, where you're from, and what you do. So Sav, can I pick on you, please? Lovely hair.
Very random. Kia ora, everyone. I'm Sav. I'm an experienced designer at Aramanua, the design studio within Auckland District Health Board. I'm really excited to be here and listen to this talk on investment. I am what I call a reformed academic and a recovering startup founder. And so having gone through the investment process, would like to see how much it's changed and what I missed out on.
Thanks, Sav. Yes, it's a bit random. Kev, how are you? Kia ora.
Hey, good, thanks. Kia ora.
Would you like to introduce yourself?
Oh, well, if you give me an option. Kia ora, everyone. I'm Kev. I am both Sami and Maori, and if you don't know Sami, that's okay. Not many people do, but we run around with reindeers and live in teepees way up north above the Arctic Circle. It's a wonderful lifestyle, but that's why I'm not there. I am coming in interested to see about the investor environment. I operate the Miruho Alveolus Institute, which is a research institute dedicated to building engagement within Maori and Pacifica communities. I look to generate change in the way that we interact as Maori and Pacifica with current structures in our workplace, in our healthcare and judicial systems. I funnel any of my extra cash to run that institute. So I'd like to see what the landscape is like for investment there. Kia ora.
Thank you. Okay, it's 12:05, so I think we'll just start proceedings. We have an hour today. So welcome everyone to the commercial translation Te Toki Mata Ora monthly speaker series. So today we're looking at what investors are looking for. And my co-host today is Jamie Attenborough from Callaghan Innovation. Jamie's got Callaghan under his name instead. Now, raising capital is a key portion of any health tech commercialization journey. And what we need to do is really understand the investor landscape out there and what it is that investors are looking for to really, try and accelerate all the translation journey that we're all on. So without any further ado, we'll have this. What we'll do is we'll introduce our panel. Each of our panel will give a five or so minute high-level summary of themselves and what they do, and then we'll open it up to Q&A for the rest of the time. So with just a little bit of housekeeping, please put up your hand if you want to have ask a question, and we'll come to you. Okay, either Jamie or I will come to you. So the first person on our panel is Will Charles. He's the Executive Director, Commercialization of Auckland Uni Services, and Auckland Uni Services is the commercialization arm of University of Auckland. Will runs our University of Auckland Inventors Fund, and he's a great colleague and a real champion of the translation journey. So Will, can I hand the spot to you?
Yeah, tēnā koutou, tēnā koutou, tēnā koutou katoa, everyone. Ko Will Charles Aho. Yeah, as Di says, I've got been here in this space nearly for about 15 years, and I've seen a huge development, both in terms of people thinking about translation research into much more impact, and people having much more say in how that journey takes place. So just a little bit of background. So we are the beneficial owners of IP that's generated by staff at the University of Auckland, and our job is to translate that into into new products, new companies as fast as possible, or to direct it back into more research or more development opportunities if the idea is one that isn't doesn't look like it's best driven to impact through a startup company or some kind of license. So often we will work with academics when they come up with an idea to help them to drive more sort of publishing, and also then doing clinical trials or being involved in clinical trials on a research development angle. We also run the University of Auckland Inventors Fund, which is a $20 million proof of concept and pre-seed fund, which we founded in 2016. And since that time, we've started 43 different companies. Around 33 of those are still going. And quite a lot of them actually are probably about 40 to 45% of them are medtech companies, which is really encouraging in this space. And thanks to the work that Di does and CMDT, we are starting to see a lot of acceleration in that space. One of the observations I would make, so my background is just prior to being here, I was in the pharmaceutical and biotechnology industries, pretty much in product management and also in general management. And prior to this, I was worked in Korea for Novartis, but prior to that, I've worked in the biotechnology industry, all the way from selling capability and contract manufacturing of monoclonal antibodies through to being a product manager for pharmaceutical brands and so on and so forth. So that's my journey. So in this space, what I would characterize the thing I observe most of all, and it's actually sort of best painted for me by a clinician engineer who I used to work with, a gentleman called Brett Cowan, who used to describe the medtech sort of nexus, if you like, as engineers will design beautifully elegant solutions for things that doctors don't care about, and doctors will come up with really crappy solutions for things that bother them every day. Okay, and so the real challenge is to get those two things really talking to each other and thinking about it from sort of getting both ends right, to focus on the patient and the disease and how that process will work. So really understanding why your widget or why your problem, your clinical problem, can be best solved either with a really well engineered solution or a solution that's good enough for the patient. The other thing I would observe is that it's quite difficult to get really valid, sometimes valid market validation, and apologize to any clinicians in the room, because clinicians are very polite and they'll say things that describe it in a very sort of, use it in a kind of very English way. They'll say things like, oh, that's interesting, which actually means I'll never use this, I'll never, this will never catch on, right? And so really understanding what pain points the clinician is facing when they see or are in front of the patient. Now, whether that's a clinician, an ancillary health worker, a nurse, or even a manager of a hospital, what really bothers them on a day-to-day basis. And then doing your design and your engineering around that problem. And being candid, quite a lot of the time we see beautiful engineered solutions for which either the doctor doesn't care about, or even if they could use this tool to find something out, they can't actually change the differential diagnosis or treatment they're going to give. And so it just becomes an extra step in their process. And so they just don't do it. The other point I would think about is that in medtech, in a lot of cases, because it's one of the questions around exits, is that if you get this right, you can actually, there's quite a good formula to follow with respect to understanding the big players in the markets you're going to operate. So I'm talking about companies like Abbott, Johnson & Johnson, Medtronic, Boston Scientific, and there are a number of others. And why it's really encouraging, if you can really understand them as a market as well, you can start to build yourself towards your exit, thinking about them as a customer, because they in the old days, those companies would have big R&D departments, and they would hire people from universities who work in those R&D departments to come up with all of the new ideas. Then around 15, 20 years ago, they started to work with universities. They started licensing IP. They started doing research programs. But typically, they would still develop the stuff themselves in the lab and also in their own product management teams. They don't do that anymore. What's happened is that these companies buy, most money that they spend in their innovation is actually in acquisition of companies because they can't hire all the smartest people in the world. And as an example, Apple buys a company a week. J&J probably buys about a company a month, probably a few more. And really what they're then buying is they're buying some products, a product line, but increasingly they're buying talent. And so if you want to be involved in getting your idea to have real world impact, you have to start thinking about why these companies are going to potentially buy you. And once you've got that, there's a formula to work back from. So that's quite an encouraging thing to think about. So those are kind of the other observation I would make is that in part of the discussion, which I think of some of the questions, is that people forget often. They say, what do investors want? Well, one of the things I would encourage you to do, to encourage people to think about, is every investor who comes in front of you, a venture capitalist, with the exception of perhaps an angel, isn't actually using their own money, right? They've often gone to other bigger investors and said, we are skillful at applying your money into other things. So if you can think about when you're pitching to a particular investor, look at what they've invested in the past. Look at the other sorts of companies they invested. Look at the people who you're talking to, because investors are not all one thing. And so you can differentially pitch your idea to an investor in a different way by understanding who their investors are, what their investment premise is, remembering that they also are investors. So when you talk to them, they're not making decisions for themselves, they're making decisions they have to explain to someone else. Okay, so if you have that thought process, imagine yourself telling a story to someone else who has to tell that story to someone else. Okay? And I don't think really people do that when they're pitching. They think investors are this all powerful, all deciding, and there's no real logic behind it. But I would encourage you to think a little bit more about that. So hopefully that's helpful. Di was and I'll hand over.
Thanks, Will. No, that was really good. But we're just moving on to the panel. Then we'll have open Q&A. Jamie.
Great, thank you, Di, and thank you, Will, for that. That was a really great talk, and it's good to get some insights into your journey and some learnings. I will do a handover now to Tamsin Bateman from NZTE. Tamsin's an investment manager at NZTE, works quite closely with early stage companies and has a particular interest in health and med technologies. So without further ado, I'll hand over to you, Tamsin.
Rookie era. Thanks, Jamie, and thanks, Di, for the invitation to come along today. So as Jamie said, I'm an investment manager at New Zealand Trade and Enterprise, and I definitely have a passion built from my background in the health tech industry. So I started my journey at the University of Auckland studying biomedical science, and I then went on to do the Master of Bioscience Enterprise program about a decade ago, interned at Uni Services in Will Charles's team. So nice to come full circle. And since then have worked in a range of roles, management consulting in New Zealand. I then went to Oxford and worked for Inventors, which is a specialist consultancy dealing with partnering and investments for life science companies. So that was a very relevant role, and worked with a really broad range of life science companies, everything from drugs and devices to wearables and digital health. So worked on a lot of licensing deals and M&A. As Will said, that is the predominant business model within the sector. So it is quite unique in that respect. The milestones are different, the exit strategies are different, and coming to a generalist team that I'm in now, that has certainly driven home that it is quite difficult for generalist investors to understand the milestones and the value drivers for health tech businesses. So currently I work in the investment team at NZTE. I've been here for 4 years. I look after at any one time 30 to 40 companies that are at various stages of capital raising. So my role is to help them prepare for capital raising. So looking at their capital strategy, helping to prepare documents, giving feedback on financial models, business models, things like that. And I also help with connections. So a big part of my role is connecting directly with investors, understanding what they're looking for, and then introducing relevant opportunities that I'm working with in my portfolio. So given my interest in health, I've taken kind of adopted that sector at NZTE and spent a lot of time with the likes of Di advocating for health tech and trying to educate some of our international markets around why New Zealand is a great place to look for health tech investments. And I will leave it there. I won't go into sort of insights. I'll leave that for Q&A, but that's a bit about my background.
Great. Thank you, Tamsin. And next up to give us a bit of an overview of their journey and background and current work is Jackson Rowland of Ākina Invest. So Jackson, I will hand over to you.
Thanks, Jamie, and kia ora koutou everyone. Ko Jackson tōku ingoa. Thank you to Di and the team for inviting me along today, and it's great to be on the panel with Tamsin and Will. So I am the director of Ākina Invest, which is the impact investing arm of Ākina. I'll explain a bit more about what that is, but maybe my journey to get there first. I was a lawyer initially, and that was part of my dream to be a big bad lawyer for life. That was the goal. But during my studies actually at Canterbury University, the Christchurch earthquakes happened. And so like 10,000 other students, I went on the streets and volunteered and kind of served for the first time in my life, and realized that that service made me significantly happier than the law study that I was doing at the time, and in turn the law practice that I did. So from that moment forward, I kind of was always looking for charities or for good organizations to work with and support. And that because that makes me happier. So I was a lawyer for a little bit. It wasn't quite on the coalface enough for me, if you like. I wasn't kind of working with those organizations that were genuinely changing the world in the way I thought it needed to be changed. So from there, went into the startup space and worked with a couple of startups, one in the equity crowdfunding space, Snowball Effect, that you may have heard of, and another education-oriented startup. Both as part of my journey to try and work with organizations that were directly kind of trying to change the world. And then eventually stumbled across Ākina, which was this organization that was trying to build social enterprise in New Zealand. That term I hadn't heard of at the time, but it was exactly what I was looking for, which is that way of doing things that combines the efficiency and drive of business with the heart and the purpose and the change that charities bring. So happily joined Ākina 5 or 6 years ago now, and have been leading our investment work. Ākina is an organization we are really trying to build or make it easier for businesses to do good in New Zealand. So we work with all different stakeholders in the ecosystem, whether it be government or philanthropy or social enterprises or corporates. Work with all of the stakeholders to help them understand what impact is and how they can manage and improve that impact over time. Investment naturally is a key lever to that. So our investment work is growing significantly, as I'm sure you've seen. The kind of interest in impact investment in particular really grows. So our purpose within the investment work is to build the impact investment market in New Zealand. And we do that in 3 main ways. One, we do a bit of advisory and kind of consulting work with the larger holders of capital. So whether that's KiwiSavers or government agencies, we work with them to help them understand impact investing and start transitioning to it. We also do a lot of readiness work. So for 5 years now, we've run the Impact Investment Readiness Program, which provides grant funding to organizations who are getting ready for investment so that they can pay for the lawyers, the accountants, those expensive things that early stage organizations just can't afford often. So this funding helps them pay for that and then go on and often raise 20 times the amount we give them in investment. So it's been a really successful program. And finally, we launched New Zealand's first impact investing fund 4 or 5 years ago now in partnership with Newground Capital and Impact Ventures. So that was, we'd seen the global momentum in impact investing and also noticed that that momentum just wasn't happening in New Zealand. So we got some friends together and said, right, we need to do this, and ended up raising just under $10 million to invest into high growth, but also high impact organizations here in New Zealand that are hoping to scale around the world. That fund has a high financial target, so it's a 15% IRR target, because we wanted to demonstrate that impact organizations delivering impact can also deliver strong profit. And we're really proud to say we've invested in 10 companies so far and are just in the final stages of wrapping up that fund. So it's been, a huge success and relief for us as the first fund of its kind trying to pave the way in New Zealand. And more importantly, I think that path that it's paved has meant there's a number of other impact investing funds in New Zealand now. So the market generally is lifting, really strongly at the moment. So there'll be more and more opportunities for the likes of you who are, creating solutions to some of the big problems that this world is facing. So I will maybe leave it there for now and can obviously share some other experience and things through the Q&A, but thank you.
Thank you, Jackson.
Cool.
And Tamsin, that was really good overview of what you both do and where you come from. So maybe I'll just kick off Q&A with the first question, which is from your perspectives, because the three of you sit in very different parts of the ecosystem, with Will being at the early stage and Tamsin, you've worked with so many different companies, but you've seen a lot of startups in New Zealand as well. And Jackson, you're on the other end with the impact balance. So my question is, how do you spot a good opportunity? And what is it to you? What is a good opportunity look like to you? So should we start with Will, since he's at the early end, and then move to Tamsin and then move to Jackson? Sorry, Will, picking on you.
What makes a good investment? Well, I guess what makes a good investment is something where the team has really articulated a validated clinical need, ideally with one or two opinion leader clinicians or people who make these decisions. Is kind of endorsing or has endorsed that view or is part of the team themselves. What I like seeing when you had a pitch is what I call gravitas, but also see quite a lot of investment opportunities where the need is a little bit general and not specific enough. So I would get down into a little bit more detail on really understanding that real clinical need. I'm often, I sort of talked about an exit strategies. The thing with lots of strategies is they tend to not survive first contact with the enemy. So keeping that bit relatively general is quite a good idea, but giving some examples of how you might get to that point. I think the other thing that would be really, what makes a good investment is where there's a clear regulatory, so there's a linkage between the patient need, the disease need, or the problem need, the person who the decision is going to make to apply that solution, and then a very clear regulatory pathway, because all of these things will have a regulatory pathway to getting there. And then how quickly, I use it. What is your first patient, first visit? So how, what's your plan to get this being used in a human clinical context, or in a hospital, or in some kind of clinic? So that would be what makes a good investment is typically those things.
Thanks, Will. And I totally agree with you. Understanding the clinical need and actually validating it, even at the early stage, is really important. So Tamsin, at the next stage, once the startup's formed and Will has supported it, and it's coming to you and knocking on your doors, what is a good opportunity? What do you see as a good investment opportunity?
Yeah, I mean, you could answer this in so many different ways, couldn't you? But I guess some of the key things for me is, whereas in a lot of other sectors, I wouldn't start with technology. I think in this particular sector, technology is core. So that's quite unique about health tech. In other sectors, things like team and market are more important, but the technology is obviously core. So I think something very novel that's not incremental, so something that is solving a very real problem that is has a large market is where it all begins, really. So the market is the second piece. So the technology is really novel and exciting. The market is large enough. That's probably an area that I see probably not covered as well as could be, or as well as investors would like to see, is that market potential piece. So understanding who your customers are going to be and how big that market is, how big could this company be one day. So technology, market, and then team is obviously really important as well. That does depend a little bit on where you want to take the business. So if you want to be bought out by a big pharma, not as important. So you might be having technical expertise could be enough for that. Likewise with licensing. But if you want to take that business all the way and become, $100 million revenue company, then having the right skill sets, the right mix of skill sets is really, really critical. So coming out of the university, often there's quite a technical team in place. So it's really important to understand where the gaps in that team are in terms of clinical, in terms of commercial expertise, and understand having a plan around how you're going to fill that, be that through advisors. That's really critical as well. So I would say the technology, the market, and the team are the core areas.
Thank you, Tamsin. That would be, I mean, having spent so much time together, that has always been your mantra, I would say. Cool. but that's so true as well. Jackson, what about you? What do you see? What's your good opportunity from an impact investment side of things?
Yeah, well, it's probably no surprises to hear that my response is going to be impact. And one, because it's beautiful and changes the world, but that aside, it's also increasingly a risk. And whether you're speaking to impact investors or whether you're speaking to more traditional investors, we've all heard the stories in the headlines about a business who have been discovered to be doing something that's not overly good for the world. And you see the value of that business significantly drop. You see the customers run away from the business, sometimes the employees, etc. So the fact that it's good for the world aside, it's increasingly becoming a risk for investors that they will be interrogating whether your business is at the least doing nothing bad. So I think it's increasingly important for all organizations to start to think about what impact are they having on the world. In the kind of health space, you'll inevitably be doing something good. So there's no major concerns for you there. Just, it's always worth exploring supply chains and the like to make sure there's nothing major that's going awry there. But fundamentally what you'll be trying to do is good. So therefore, the thing for you all to be thinking about is how do we articulate this? It's one thing to just know in your gut that you're doing good for the world, but then secondly, how do you actually describe that to investors? And that's equally important and surprisingly sometimes not done very well because it comes from passion. It comes from just knowing you're doing good and you've never kind of thought about how can this be communicated to another party. So I'd really encourage you to, one, be really conscious of the impact you're having, and then equally importantly, make the time to think about how you describe the change that you might have in the world to another party in a way that they can understand it.
Okay, that's fair comment there. Saab, you had a question that would be really nice to follow up with what Jackson's just said. Would you like to ask it?
I'm just curious for impact investment. How critical, when you've got a startup coming to you, how critical is it that they have considered the externalities of their product and services when they are coming to you? And how do you support them through considering those and planning for those and designing around it?
Yeah, great question. And naturally, I think with a lot of today's conversation, a theme will be it does vary a bit between investors. Some will be have a lot more stricter analysis and diligence in this area than others. But what I would say, and certainly what we see in the market, is it's difficult to do everything perfectly, right? Like most organizations are going to generate a bit of waste. They're going to, there's going to be maybe some fossil fuel driven power that they use, for example. There'll be a number of things that aren't perfect in the way the business runs. And my hope is that investors don't get hung up on those things. My hope, and certainly our approach, is that we look at what are the most significant things your organization does. And typically those significant outcomes or impacts are positive impacts. If the most significant things you do were negative, that's when we'd get concerned and probably wouldn't invest, but more importantly, encourage you to think about how you can start to change that. So for us, and I hope most investors, we start to look at the most significant things and look at that as the positive impact and acknowledge that there will be some externalities and other challenges that are created through that. And as an investor, once invested, we should all be working with you to maximize the business in the most holistic way possible, which one includes enhancing the good and the profit and that kind of thing, but two includes reducing the bad, because as I say, that just happened, but it can be minimized. So hopefully those externalities can be managed over time, but I would hope that investors don't get hung up on them at the early stage.
So, oh, sorry, Sav. Thanks,
I
Jason.
can comment on that. I can comment on that. So, Sav, I think a little bit on that. So in quite a lot, and particularly when you were talking about medtech here, quite a lot of business models in medtech involve disposables, and that's that's a key consideration nowadays. That certainly 5 years ago wouldn't be a consideration. Now it has to be. Reusability or whole of life. From construction through to reuse or whatever it happens to be. Those are much more important considerations than, and rightly so.
Great news. Thank you.
Great. Thanks, Will. We have another question from Natalia. Would you like to ask that, Natalia, or just let us know if... Okay.
Yeah, kia ora. I am being told I have unstable network connection, so if I cut off, apologies. So I had a question for the panel. So I'm working with a group within the ABI at the moment, and of course our goal is to get a medical device and get it commercialized. And one of the things I've noticed is that some New Zealand medical device companies, maybe startups, don't tend to focus on New Zealand as a first market. So I just wanted to get some feedback from the panel. What do investors think about that? Do they expect you to do New Zealand market as default, or do they expect you to always have, a bigger market in mind? So yeah, I was just curious about that, because the New Zealand market, at least medical device, is not so straightforward as some other markets, in the sense that, for example, the US or the EU, you have all this information available as to what the regulatory pathway is, but New Zealand tends to be a little bit more of a black box. So yeah, I was just wondering what the panel thought about that.
Yeah,
thanks.
I'm happy to take that.
Yeah, I was going to suggest you start with you, Tamsin.
Yeah, I have heaps to say on that. It's a really, really great question. If you never looked at New Zealand, investors would not blink an eye. New Zealand is but a dot on the world map. And from a market perspective, the expectation is that you're thinking globally from day one. So there are some distinct advantages to developing a startup in med devices in New Zealand, and that's primarily around like accessing DHBs and things like that, and accessing clinicians, generally trialing in New Zealand or working with a top clinician in the field is very doable here. But when it comes to actually turning that into paying customers, it's really hard in New Zealand. And I totally pick up on your point in terms of the regulations as well. They're quite opaque. And so I would encourage you to think about New Zealand as sort of a great market for testing and trialing your product, getting some reputable clinicians excited about what you're doing, but really having a razor focus on the large markets internationally when it comes to sales and regulations and reimbursement critically. So investors will have that expectation as well, I would expect.
I think yeah, I would echo that, Tamsin. I think very much so. These are global things. I think whilst I wouldn't want people to go away necessarily thinking the New Zealand regulations are opaque and difficult. The good news about this is that they take a very pragmatic ethics committee approach. So the Scott Committee and other things take a very pragmatic approach to allowing these things to be put on for sale. They don't describe reimbursement. The advantage of that approach is you have to go and talk to a bunch of doctors, and you have to have them, and you have to have presented a case in quite a lot of detail, just as if you were going to do an experiment. So New Zealand then becomes quite a good place to get some human proof of principle. And if you do it with larger markets regulations in mind, so you say, for example, if I'm going to do this in the United States, I'm going to do this in Europe. These are the key things I'm going to have to answer, both from a regulatory point of view, but also a reimbursement point of view. And you build those into your case in New Zealand. You can actually get that human data without having to do any clinical, big clinical trials in the first place. So when you go to the United States, or you're going to investors, you've got some kind of human proof of principle that it works. Because at least in drug development, much more so than in medtech development, animals lie. Right? So and what I mean by that is animal experiments are very often misleading. So human data trumps everything. So I would think about the New Zealand environment as an opportunity to get early proof of principle. It also drives you to have to talk to the clinicians who are going to be using it.
Right. Thank you. So a follow-up question, if that's okay. Do you think investors may see it as a distraction if you're a small team, startup, and you're focusing on New Zealand market and another larger market? Or is it doable to do both at the same time?
I think the answer to your question, Natalia, is why you're doing it, rather than a zero-sum game as to one or the other, or them somehow competing. Right. I think you'd be saying, I'm here in New Zealand because it's cheaper it's more cost-effective and efficient for me to get some kind of human data in New Zealand before I go overseas, or at the same time. Right. Rather than saying, I'm focusing on the New Zealand market. What I'm focusing on is using New Zealand advantages to get to a point at which I can globally sell or globally make an impact and have my product in front of patients or changing a hospital system globally, because that's how you'll have the most impact. Right.
Okay, perfect. Thank you. Really appreciate that.
Thanks, Will. Simon, you have a question.
Yeah, thanks, Di. Hi, everyone. Just by way of background, I'm at Victoria University of Wellington. And my question for the panel is, I've noticed a trend. We often have graduates in different fields who aspire to open their own businesses, initiate a startup, and they don't necessarily have the classic, here's the idea and it is IP protected, but what they do have is a very clear, sometimes quite remarkable expertise and capability. And I guess my question is that in itself a marketable commodity that is of interest to investors, or are investors typically looking for something more tangible? for example, registered IP?
I think the observation I would make, Simon, is there are loads and loads and loads and loads and loads of smart people around the world. And our students, with the greatest of respect to our students, are no different to students in Australia or in China or in Hong Kong or in the UK or the United States. So I think, when we see them, we like to think positively of them. But I think it's not necessarily having tangible IP. It's a pathway towards why is my idea smarter than all of the other ideas around there? And so what advantages do I have, and how can I give myself some time to protect those, right? And so I, as an investor, hate hearing things like, well, I'm cleverer than everyone else in the world, or my trade secrets are better than anyone else in the world, because they're patently not, right? And so I think, what I would be encouraging those students to do, if they can, is, and on campuses, we have lots of these things, is get involved in things that are on campus, like your business plan competition, your some of those things, because at the end of the day, if you fail with those, it doesn't, nobody's lost a house or something, but what you've done is you've learnt on the way through some of those processes and whatever. But to be honest with you, this is a game about protection of your idea in some kind of way or form, because without them, it's very difficult to get the kind of investment you need to prove that you're going to make a difference.
Can I add to that, Amy? It's a really good question, Simon, especially as technology evolves. I think that classically we think about patents as being the core IP that is defensible, but I think it really depends on the investor that you're targeting as well, because some investors have an absolute aversion to non-patents. They only invest in really heavily protected, patent-protected technologies, and that's their mandate for investment. But then you get other investors that don't have that mandate, and of course, defensibility and what we call here a defensive moat is critical, and you will be expected to answer that question in a robust manner that clearly demonstrates that you can defend your IP, but that doesn't necessarily need to be in the form of patents. So I think it depends on the technology, and it depends on the investor that you're talking to, and so targeting the right investors for the type of IP that you have, I think, is really key.
I was just going to add to that, Tamsin, and Jackson, maybe you have a view as well. I mean, in New Zealand, and this is what I've, around the tracks, it's really difficult to find investors that will invest in know-how as opposed to patented IP. So do we really have investors in New Zealand that will be looking at non-patented IP? Or is this more of or is it just, more of a maturity thing, and it happens more overseas?
We do have, certainly in New Zealand, we have investors that invest in non-patent protected IP. Pretty much all software is not patented, it's protected through algorithms. There's lots of processes and things like that you can protect through trade secrets and whatnot. And you certainly do get investors that look at that. But if you went to talk to a Pacific Channel, for example, and your IP is non-patent IP, that does not fit their mandate, so they would not even look at it. So that's what I mean in terms of targeting. But certainly there are investors that will look at IP in a different form to patents.
Yeah, sorry, go on, Jackson.
Just briefly, I'll just add that I think it's really important to remember that this intellectual property is just one piece of the broader puzzle with your organisation. And going back to the comments that were made in the first question, there's a number of really important things to be thought through. And a number of times I've been presented to by an investor, by a business, and they've got a really strong IP strategy, and there might be a patent or things are as they should be, and they think that is the only precursor to getting investment. And it's sometimes a bit of a shock when we say, well, actually, what's the biggest strategy to monetize this and actually grow the business and achieve the goals you're working towards? So whilst this stuff is important and having a clear strategy is important, equally it's really important to couch it in the other key aspects of creating a successful business. Sorry, Will.
So no. So I mean, I agree with all of those things as well, and I think we obsess about patents. There are other forms of IP. What I would say is that, and I see this a little bit, is that when people come with a know-how, or my suspicion is you haven't done a really good competitive analysis. Is really what you're saying, right? Or what inventors? No, not what you're saying. Is what investors might hear, right? Because if you just say, well, I've got all this know-how, and then you ask, you've asked some follow-up questions, you don't have a clear strategy of how you're going to turn that know-how, or how it is really know-how versus what lots of the rest of the world already knows. So it tends to be, to me, a strategy being a hygiene factor. IP itself is not a product, definitely isn't. That's been demonstrated. The IP is not a company, it's not a strategy, it's not a thing. There's a whole bunch of other things to do before you do that. But it is, I look at it as part of understanding why you're cleverer and why your idea is going to win, rather than necessarily obsessing about whether it's a patent or something. But it's often a signal that you've done some really good DD about where you fit.
I think that's really good. That was a really good discussion panel. Thanks
a lot.
Yeah, and it's dispels some of this myth about if I don't have IP, patentable IP, I can't talk to investors. So we probably have time for about 2 more questions. Is there anyone from the group that might like to ask a question? John.
Kia ora koutou. So I did put a question in the chat, but I didn't articulate it very well. And I probably won't articulate it well verbally because it's a bit of a difficult one. But I was really, so I'm a neuroscientist from Otago, for those who don't know me. I was really interested in hearing Jackson, who's one of the few sort of talked a bit about the public good side of impact, actually improving people's lives, of course, that we're all trying to do, but also potentially saving money within the country in terms of improving people's lots. But what I don't know if is that more of a pitch of interest to MB, or are investors also interested in what good is being done, for example, in New Zealand? We've kind of sold that a couple of times, and it kind of comes back, well, the money's going to go internationally. There's not going to be anything ever returned to New Zealand. So I was just interested if anybody had an answer to that difficult question.
I'll add a few comments, and then I think Tamsin, with the breadth of investors you see, you can probably comment on the trends, because I appreciate that I'm in a bubble, and absolutely, a lot of the investors I'm talking to certainly look for this. But what I think is important, thinking about the market more generally, is that broader investors are starting to look for just what are the broader outcomes that an investment makes beyond just financial profit. The challenge is that with limited measurement experience, the kind of the way they might try to track that or ask you to track that can become quite complicated, seem impossible, and then the conversation stops because it all just becomes too tricky. So I think the more you can be clear on what those broader impacts are and have it as part of the sales pitch, but don't expect it to be the focus of the sales pitch, I think that should be in your best interest. Yes, absolutely, MB and others are increasingly looking at this since the wellbeing framework was introduced a couple of years back. But I would say even at that end of town, there's still some work to do to better understand how they can, enable you to pragmatically measure and report those outcomes, which is some of the work we're doing with government at the moment, but it's a long journey. But yeah, Tamsin, I'd be interested for what you're seeing across investors more generally.
Yeah, I certainly agree, Jackson. I think across almost all investors, there's a tendency towards looking at what we at NZTE call good for New Zealand and good for the world. And I think that that's only going to increase. So Movac, for example, our sort of original VC in New Zealand, if you look at their portfolio, a lot of them would tick impact boxes. However, it's not a measurement that they apply when considering their investments. So I still think that measurability piece is still quite unique to specialist impact investors. However, yeah, like I say, if you analysed a portfolio, I think you would see quite a significant trend towards more appeal and more tendency to invest in those good for the world types of startups.
Kia ora.
Thanks everyone for that. That's also another very important discussion. I think it touches on the sort of health economics as well, and it is a growing theme globally. So thanks for that discussion. Before I ask the final question, we had one input from Byron. Byron, did you want to just jump in?
Can you hear me?
Yeah.
Oh, sorry. It's probably very basic and probably a lot behind it, but is there a list of currently open funds that are interested in health tech maintained by, well, I don't know, CMDT or Uni Services, or I guess if it's public would be more interesting.
I don't believe there is, no. There's the Ice House has a list of all investors across New Zealand and Australia, but does not include sector specialties.
Pretty easy to Google it. Well, that's what I've done. It's not, you can just, and you'll probably get quite a few.
Maybe we should compare our Google list then.
Yeah.
Well. Okay, thank you.
I mean, I think the thing is, Byron, the other issue you've got is, I mentioned that thing before about, these funds have, they're not investing their own money. So lists themselves tend to not be worth very much. What is really interesting, much more interesting, is perhaps asking at what stage the fund vintage is at. So for example, how old is the fund? So if you're talking to an investor whose fund is at year 4 or 5, then they're just, in a way, some of the conversations are, they may well have made all of the investments they're likely to make with that fund. And what they're doing is they're talking to you about ideas that may be 2 or 3 years' time, because they're thinking about raising another fund and going back to their investors and looking for another fund. If you can catch in that sweet spot where their fund's about 2 or 3, 4 years old, then that's so there's a timing aspect to all of these things with some of the funds you're talking to. So again, I went back to the point I made in my preamble. Understanding where these different investment funds are is part of that, part of the DD around your market. So you're looking at your market from the point of view of your patient, your doctor, your exit partner, but also you're looking at the market from the point of view of the investor. So just thinking about mapping those, just call it customer journey maps in the broadest sense, is probably the best way to look at it.
Great. Thanks for that. And I think we'll sort of do one final question from me and to close up. And I think we'll ask just for each of our panels to just provide sort of one thing, because it is potentially a multifaceted question. So sort of, if you could think of one particular thing that you'd like to give advice on, what advice would you have for founders as they are setting up their first companies? Could I start with Jackson on that one?
Yeah, absolutely. I genuinely try not to sound like a broken record, but I'm struggling to think of how to phrase this differently. But, again, impact is great and lovely for the world and things. But more importantly, it's where all the transformational organizations are coming from these days. So I think if part of your vision is making a significant change for the world in the health tech space, for example, I genuinely think some sort of social or environmental significant outcome needs to be part of that. Yes, impact is good because it changes the world, but most of the significant businesses you hear of, particularly increasingly nowadays, if you like, do have some sort of social or environmental mission at their core. So I think, again, get beyond just the gut feel of what you're doing is good. Think about what actually is our mission and how could this change the world. And having that unified vision around that purpose will go a significant way towards creating a commercializable and extremely successful business in the long term. So just be really clear on what that significant impact could be from day one.
Thanks, Jackson. Will, would you like to jump in?
Yeah, I think really understanding two things. Why, what transformation your technology is going to make. Ultimately, it ends up with the patient. But secondly, how easy is it for the person who's making the decision about that patient to make that change and implement that change in a way that is affordable for any health system. So whether that's reimbursed or government funded.
Yeah, ease of adoption is critical. Slot into existing systems, otherwise it's difficult, right? Tamsin, I'll leave it for your final close off.
Oh, that's a really hard question, Jamie. I'm going to do Di a favor here and talk a little bit about cap tables because I know she was keen to cover that off today. So just, you know, I'm sorry if I'm telling you things that you already know, but cap table being your shareholder list and who has what amount of shareholding. That's really, really critical to consider from a very early stage. We see a lot of companies coming through where dilution is an issue from early on. And if a founder is too diluted early on, then investors find it really difficult to invest and to feel comfortable that the founders are going to be properly incentivized to drive that business forward. So I guess one of the most important things at this early stage is to think about how to set up, how to structure the business from day one in a way that's going to set the business up for future success, because you will have to bring investors on over and over again, particularly in health tech. It's a very capital hungry industry. So you will do multiple rounds of capital raising. So from day one, really think about who is in this for the long haul, who wants to take this business forward, and how are they going to be properly incentivized through equity shareholding. That is my last point.
And thank you, Tamsin. And thank you for remembering that I did really want to cover off cap tables as well, because I think that it's really good for the community to understand this and to get the proper advice from day one. We've run out of time. It's 1 o'clock and we've had a fantastic discussion. Thank you very much, Will, Jackson and Tamsin, and Jamie for co-hosting and Ella for pulling this together. And I guess I'll leave you with a couple of just a very high level summary, because we've heard so many good things. 3 things when you're starting a medtech company that's important to your investors: technology, market being large enough, and the team. And looking forward into the future, impact is important. Understanding what impact you're going to make, especially and having that narrative around a social and environmental mission. And understanding that, you know, what you're developing is not just for New Zealand, but it's also good for the world. And it's true, what's good for New Zealand is going to be what's good for the world, so that you can actually take it to market. And finally, it's also about how is your idea cleverer than others? And that was Will's mantra in a way. And that's something that, you know, I guess the University of Auckland people who've come to a return on science will also remember. Just to remind everyone, before we say goodbye, we have an open mic session on Tuesday the 3rd from 12 to 1. And this is for everyone to come together, if you so wish, to have a bit of a discussion about what you heard today. So with that, I think I'll close off unless there's any final words from anyone. No? Thank you very much. And thank you again, Will and Jackson and Tamsin.
Thanks, everyone.
Thank you.
Thanks.